Amidst the upheavals of the Great Lakes region, communities face dire challenges, humanitarian crises threatening lives and stability. The influx of vulnerable people fleeing armed conflict and violence in the Democratic Republic of Congo and South Sudan compounds the urgency. The Humanitarian Protection Project, implemented by the Uganda Red Cross Society, is providing a protective mantle for those most in need through targeted assistance in refugee settlements of Kyangwali, Bidi Bidi and Imvepi to safeguard lives and restore dignity in the face of adversity.
Our specific objective is that we would effectively protect the vulnerable population, who are the refugees and asylum seekers, against the risk and consequences of threats linked to the humanitarian crisis and the refuge that they have taken in Uganda.
Focusing on areas including water, sanitation and hygiene, first aid, disaster preparedness, blood donor recruitment and the promotion of international humanitarian law, the project's core vision is to deliver sustainable humanitarian assistance to persons of concern, concentrating on saving lives and supporting livelihoods of these vulnerable people.
We managed to conduct a baseline survey which informed us the actual needs on the ground for both WASH, gender and inclusion. Two, we also achieved training of 25 trainers in participatory hygiene and sanitation transformation, an approach which entails the communities to identify, solve and be part of the process to solve the problems that have been identified.
When we talk about sanitation in general, we talk about the environment. And when we talk about the hygiene, we talk about the personally. And when we talk of transformation, people to change from bad attitude or negative attitude to good attitude. Before the training of first, people are defecating anyhow. People they don't have latrine, they don't have better shelter, even they don't have rubbish pit, they don't have drying line wire, they don't have drying rack. Now with that knowledge, I think people have improved in Blaze 5.
Over the course of this project, there has been a noticeable enhancement in personal and community hygiene within the refugee settlement. Several activities including hygiene promotion campaigns, the establishment of sanitation facilities, distribution of hygiene kits, waste management initiatives and educational sessions have collectively contributed to this positive change.
Because at that time there was a lot of insurgencies and unsettlement and incoming of the refugees from South Sudan, and many of them we had a number of challenges in terms of menstrual management, hygiene management. We had a challenge of first sanitation related, hygiene related diseases and challenges. That's what we had. We also had challenges of deposit of fecal sludge management, because most of the latrines that we had by then were filled up.
We also managed through partnership on the ground to construct, in the first phase, we managed to construct 45 latrines. This was done in partnership with the Water Mission Uganda. We also managed to train water user committees. 20 of them were trained and they were facilitated with what we call cleaning, water point cleaning kits, which involve the wheelbarrow, a spade, spanners for repairing minor repairs, and at the same time other materials. The major focus was on operation and maintenance of these water facilities, the role of men and women in maintaining water sources, and at the same time, how do we protect people with special needs to access water without difficulties.
I worked with the Austrian Red Cross in the construction of the first ever fecal sludge treatment plant in the whole of West Nile sub-region. As you know that the fecal matter being disposed by the refugees, we have to remove them and find somewhere to safely deposit them without harming the environment in a safe way for the public health.
They also constructed for us a vermicomposting house where we have a plan of improving our manure within the treatment plant. They have also constructed us the solid waste house where all the solid from the marketplaces will be brought here for sorting and other management.
In the Bidi Bidi refugee settlement, extensive training sessions were conducted to teach valuable skills on making reusable sanitary towels for women and girls. This provided a sustainable solution, ensuring access to hygienic menstrual care while fostering self-reliance within the community.
We are conducting a training in making of rewashable pads aimed at supporting women and girls under reproductive age to ensure that they have the capacity of making their own menstrual hygiene kits instead of buying materials which are expensive and of poor quality. We have also empowered these communities through giving them materials like the soft towels, the threads, the scissors, the napkins, the batons, and then also the manila cards. All these are materials that are used in making the pads. We have trained them in a capacity thinking that in the future they can turn this one into an enterprise whereby they start slowly making the pads and progressively they will start selling them.
As part of its commitment to enhancing first aid training and bolstering blood donor recruitment, the project organized comprehensive training sessions conducted by the Belgian Red Cross.
Since we had the training, we have benefited a lot in recruitment of blood donation. And so far, before we had the training, the units of collection were very few, but it increased in the whole region.
So in the sufficient blood collection so far, one of the approach we did was training volunteers in the project areas. We trained volunteers in Arua, and these are community-based volunteers in Arua and Hoima, so that in the event of blood collections within their areas, they are able to mobilize their communities effectively to come and donate blood.
These sessions were instrumental in augmenting the expertise and capabilities of Uganda Red Cross volunteers. The aim was not only to empower these volunteers to proficiently train communities in administering first aid, but also to equip them to directly offer this crucial service themselves.
We offered first aid courses. We adapted new first aid courses. The most important one is the youth first aid, which we didn't have. In the past, our first aid courses were one course curriculum for all target audience, but this time through this project we have adapted a new curriculum which is for specific ways where young people learn how to provide first aid. We also integrated the basic first aid, which is aligned to the international first aid and resuscitation guideline of the IFRC. So we developed manuals that is helping us to run this. We also procured and distributed assorted training equipment to the different branches where we have been implementing, and also extended to the National Society in the different branches. So through this we had the training of trainers, and the trainers, after qualifying, they helped to roll out the youth first aid and basic first aid to refugees.
This project supported us very well in a capacity building. We were fully trained from the first levels up to TOT level. As I speak, I am a TOT in first aid.
From the trainings we undertook from Hoima, we were able to get the skills, and here at school we have saved lives of students. Among others, there's one called Eria. He got an accident and he hit his head on the floor of a cemented ground. He had serious bleeding. We managed to clean the wound, we dressed it, and we referred him to Kituti Health Center.
To enhance the resilience of refugees, the project introduced a cash voucher system. Through this initiative, refugees received direct cash assistance, enabling them to kickstart their lives within the settlement and enhance their livelihood opportunities.
Mainly, we have been doing cash, multi-purpose cash for livelihood, where we give the vulnerable refugees cash to support them, first of all, to meet basic needs, but also in the long run, start up a livelihood that can help them to continue with survival in the settlement.
This practical approach aimed to empower individuals to rebuild and improve their circumstances, fostering greater resilience within the refugee community.
After giving them the multipurpose cash assistance, they had the liberty and choice of what they wanted to do with this money. We didn't condition it, but we integrated financial literacy, which encouraged them on how to use this money well and how to keep record. And through this financial literacy and engagement through our community-based volunteers, we were able to see a multiplier effect from the money we gave. The beneficiaries actually initiated income-generating activities for the different households. Some opened small businesses, some bought animals like goats, chicken, and poultry in general, as well as piggery and farming like agriculture, crop production. So they were using this money to reproduce more money, and we are happy that through that they have become economically independent.
That money which I received, I know it can help me with my family. So, because this money organization gives us, or Ugandan Belgian Red Cross help us not to use it just you eat without planning. It gives us so your future can be okay ahead there. So that's why I use this money to plan anything, because I do my budgets. It can help me in the next year. That's why you see I buy these chickens here. It can help me. Even the other ones, they are inside here. They are now there are 4 here, about 46 eggs inside here. So these ones, according to my future or my planning, ahead there, if there is no money or I don't have anything, I can choose on these things, or 1, 2, I sell it, and then I will begin and continue ahead.
The project took a forward-thinking approach by considering the sustainability of its interventions beyond the project's timeline. Efforts were made to establish mechanisms that would ensure the continuation of the positive impact achieved, ensuring that the benefits and progress made would persist beyond the project's implementation period.
For sustainability purposes, we have subdivided these communities or the participants. For here, we have subdivided them into groups, whereby the one group will continue sharing the skills with those people who did not attend the training. Like we did it in soap making, we only trained 25 people, but as we talk now, we have 3 groups making soap. So, like the same in reusable parts making, these people will share the knowledge, train others, and it continues like that.
With the sustainability, we've gone green. Our project was more on the solarization, and all our systems are using solar. We don't have generators, of which we know the challenge of the biggest achievement for solarization, the biggest challenge is it needs higher capital to buy it, which we have, Red Cross have already done it, and which means maintenance costs of these water systems have reduced thoroughly down to less than 5%, and which means also these systems have all their water users committee and scheme operators trained and equipped. So we feel that after these systems have been since they're in operations, and ministry through the umbrella water and sanitation are going to pick them up for maintenance, because under the other systems are still being managed under the development partner under UNCR, which is Water Mission, but most likely the handover of these facilities will be handed over to to umbrella organizations. So we are very sure, even after a few years or 5 or 10 years, these facilities will be working because it will be under a sustainable way of management.
In this transformative journey, the Uganda Red Cross Humanitarian Project emerges as a testament to resilience and compassion amid the trials. From improving personal hygiene to nurturing economic independence within refugee settlements, these initiatives' interventions have made tangible differences. Beyond immediate aid, the project's focus on sustainability ensures a lasting legacy through knowledge propagation and eco-friendly practices, making a new chapter in sustained progress.